Is it APOB?
Yep,
Yeah.
ApoB, right?
Yeah. So walk us through that and understanding what that is, what it means, and how do we know?
Exactly. So I think everyone's heard about like watching your cholesterol levels, right? Okay. So right now, what happens is you get your cholesterol levels measured sometimes in your 30s if you're lucky. Usually, doctor will wait till you're 40. And unless it's like over a really high number, no one's really going to do anything about it. And then people will start talking to you about your diet and managing your exercise, exercise more, eat better, eat less fat, eat less cholesterol. Then you just kind of let it go until all of a sudden it's an emergency for you to get on a statin, And I think it's kind of 10, 15, 20 years too late at that point in time, right? The damage has already been done. If you do cardiac testing, you'll see that there's already blockages in blood vessels at that point in time. And most of the time, these are not diagnosed until people have their first heart attack. No one even looks at the blood vessels until you've had a heart attack. And it's really sad the way this whole thing goes. And it's especially sad because heart attacks and strokes can become like an orphan disease, like a disease that never affects us if we just do it right. And this is where I think medicine has made like a tremendous, incredible amount of knowledge has been gained. And this is where I try to really encourage my patients to really partner with their medical doctors and really get this treated. So when I say know your ApoB level, I love ApoB. It's a new type of cholesterol measurement, kind of lumps together all the bad forms of cholesterol, which I even hate saying bad cholesterol, but it lumps that together, the dangerous forms. And knowing what your ApoB level is when you're 20, 25, that's kind of the baseline where you want it to be, right? So as this starts creeping up, you want to start doing things about it with your exercise, diet, sleep, gut health, all of that matters. But then when it gets to a certain level that's a little bit too high, that's when you want to start doing cardiac testing and diagnosis. So there's really great tests that can be done now, CAT scans of your heart that can tell you 20, 30 years ahead of time before you have a heart attack if you have a blockage. And we have great therapeutics now to turn back the time on these blockages, to get rid of these blockages to prevent you from having a heart attack.